Hi, and thanks for being here this evening. Did you know that the Hispanic population within the U.S. has continued to grow, as it's increased by 4.5%, or 5.2 million people between the years 2014 and 2019? And yet, the availability of mental health services offered in Spanish for this growing population has only declined within the same time. This trend is only expected to continue as the projected estimated population of the Hispanic community within the U.S. by the year 2060 is estimated to be 119 million, or 28% of the population. I chose this topic as it's near and dear to my heart as a licensed mental health professional who has seen firsthand the high demand for Spanish-speaking mental health providers and the unmet need and the presenting need of an increased Spanish-speaking population that we see seeking services. With Spanish being the second most spoken language in the U.S., it's critical that there are enough mental health providers who are fluent in Spanish to meet this need and provide quality care. So today I want to inform you about the current need and high demand for Spanish-speaking bilingual mental health care providers and shed light on this healthcare inequity and disparity. This demand has multiple implications and challenges, but the ones I will be covering today are the consequences and impact of this current issue, the impact on therapeutic alliance and treatment outcomes when services are offered in Spanish, and the role of stigma within this community that often keeps this population from seeking out mental health care. There's a significant growing need and demand for more Spanish-speaking mental health providers to be able to address and meet the needs of the Hispanic community. When people are not able to access care in their native language with providers who are bilingual, practice cultural competency, and understand the nuances of Hispanic culture, this population is effectively shut out of mental health care that lead to greater challenges both individually and community-wide. Firstly, the implications and consequences of this issue are far-reaching. Not being able to offer treatment services that people need in their native language greatly restricts and limits their access to services, which widens the health inequity gap and increases racial disparities. Language barriers often serve as the top reasons why Spanish-speaking individuals don't seek out services. That means when they don't seek out services, they're not being counted or represented in the data for treatment, and they often go undiagnosed, underserved, and untreated. Research shows that individuals within the Hispanic community are more likely to report symptoms of depression than their non-Hispanic white counterparts, and less likely to receive mental health care. These higher rates of symptoms are likely related to issues such as immigration-related stress, economic hardship, and discrimination, which can add up to greater rates of depression, anxiety, and post-traumatic stress disorder within the Hispanic community. Additionally, language barriers often lead to miscommunication, misdiagnoses, and overall inadequate treatment that does both the client and their community a disservice. One of the key components of any mental health professional's role is gathering information as part of their assessment to be able to understand and diagnose the patient in front of them. Their assessment guides and informs treatment. If providers don't accurately understand or have a full picture of the client's presenting issues due to language barriers, they will not be able to accurately treat the mental health issues since they're not starting with an accurate understanding. Research shows that monolingual children are more likely to be misdiagnosed and receive inaccurate assessments of special education services when these assessments are completed in English. This means that children are being mislabeled, inaccurately assessed, and not getting the proper services they need. These linguistic challenges are some of the biggest reasons why Spanish-speaking individuals do not seek mental health care. And this means by not offering services in their native language, their access to treatment and recovery are limited and go underserved. The second point for consideration is the projected benefit and improved outcomes that could be had if linguistically responsive mental health services are offered. If mental health services were more frequently offered in Spanish, monolingual clients would experience a greater therapeutic alliance with their providers, which would lead to greater mental health outcomes. Research has shown that clients who do not speak the same language as their provider are more likely to struggle to express their feelings accurately, have less trust in their provider, and overall make treatment less effective. As of 2023, only about 8% of all psychologists are of the Hispanic heritage, compared to that of their white counterparts at nearly 79%, according to the American Psychological Association. Having more representation for the Hispanic community among providers would lead to improved outcomes and benefits, as a lack of representation among providers leads to a lack of trust within the healthcare system. Studies have shown that within the Hispanic community, there is a general and deeply rooted lack of trust in the healthcare system due to a lack of representation in providers, discrimination, and systemic racism. There are clear benefits for offering Spanish-speaking services by having bilingual mental health providers, and these benefits far outweigh the costs involved with providing these linguistically responsive services. The final point for consideration with this issue is the role of stigma around mental health within the Hispanic community and how this can often be a barrier when accessing mental health care. It's common for monolingual Spanish-speaking individuals to avoid seeking out treatment due to them not being offered in their language and also the stigma associated with it. For instance, one study explored how the Hispanic community views mental health services and the perceived barriers for seeking services in the Midwest, and found that barriers included fear about legal issues when seeking mental health services, such as being undocumented. Additionally, there are cultural values or concepts at play within the Hispanic community that lead to avoidance of treatment. These can include concepts such as machismo, the importance of strong or dominant traits, familismo, the importance of family, and this may cause the population to view mental illness as shameful or a personal or moral failing. These cultural norms perpetuate the stigma if they are not met with a culturally competent Spanish-speaking mental health care provider who understands these values. And it's therefore critical that Spanish-speaking services are offered by culturally competent bilingual providers who can approach treatment with the awareness, sensitivity, and responsiveness for these cultural attitudes against seeking treatment. There are many ways in which the stigma around seeking mental health services keeps the Spanish-speaking community from effectively seeking treatment. Having and offering mental health services that are delivered by culturally responsive bilingual clinicians would help to mitigate the stigma and decrease barriers to treatment. In conclusion, the key points for consideration discussed here included the consequences and impact of the issue, which are far-reaching, the impact of therapeutic alliance and treatment outcomes if services are provided, and the role of stigma as a result of limited services offered in Spanish that keep this population from seeking out care. So if you ever wonder why a member of the Hispanic community that you may know doesn't seek out treatment for mental health issues that they may report or may be having, know that they face very real barriers to doing so in a system that was, by design, built to exclude them by not offering services in their native language. Know that the need for Spanish-speaking healthcare providers will only continue to grow as the projected population of the Hispanic population continues to rise, which makes opportunities for cultural and linguistic responsiveness all the more important.